let's talk about our next guest, Doug.
We have Dr. Arnon Krongrad with Allevion, who's going to be talking about a new surgeon marketplace. And I'd like to welcome on the program Arnon right now. Arnon, welcome.
Morning. Thank you very much for having me.
Yeah, good to have you, and it was nice to spend some time with you in Atlanta. I appreciate you joining us at the Atlanta event.
It was an eye-opening conference for us. I think you met Kim Langer. For both of us, we had never been to anything like it. It was great to see what was going on in the market.
Tell our audience, tell our audience what you're doing. Give us the background on Surgeo, and let's talk a little bit more about it.
Surgeo is a product, a service of our company, and it came together through a shared vision. Kim Langer, formerly from United Health Group in Minneapolis, joined me a couple of years ago to handle the technology and software side of things. I'm a surgeon. I've been at the bedside literally for 50 years, since I was 6. My dad took me on a house call. We believe that every patient is looking for two things: simple access to quality care. And what we see around us, of course, is the opposite. We see a contraction of choice. We see rising costs. And the question is how we can reverse that tide. The idea behind Surgeo is to co-opt the good graces of surgeons who, in almost all cases, are extremely willing, cooperative, thoughtful people who, like us, believe that every patient deserves simple access to quality care. Surgeo is an online marketplace. It delivers, in essence, 3 things, and we can talk about any of those things individually. Number 1 is quality, and we should talk about what quality is in the operating room and how you find it, how you measure it. Number 2, simple access, in this particular case through comprehensive service packages that eliminate the minutia that we're all used to, the bureaucratic minutia that we're used to. And number 3, a simple financial environment in which the packages that you buy include not only the primary but also the ancillary procedures, so there are no financial surprises. There's a flat, clear cost associated with these packages. In many cases, the packages include complications protection for financial peace of mind. So again, 3 things: quality, simple access, and financial simplicity.
Let's talk a little bit about quality. Talk a little bit more about quality.
Quality, to some extent, is in the eye of the beholder, but what we see around us generally is an emphasis not on what surgeons would call quality, but on what one might call member experience or satisfaction. Mm-hmm. For example, it's not uncommon to see measures of things like parking and waiting room times. Those are important. We would never want to trivialize the importance of having service that was accessible. However, those are not substitutes for things like how much blood was lost, how long did the operation take, were there bowel perforations, did the operation achieve its objective, longer life, better function, and those sorts of things. So in the context of Surgeo, when we talk about quality, what we're talking about are clinical definitions of quality, like blood loss as just a simple example. So now the question is, how do you find it? The reality is there aren't any good tools that will give you an objective measure of quality. There are general tools related to risk. For example, the American College of Surgeons publishes an online risk calculator, but that actually measures you as a patient and your risk of going ahead with your knee replacement, bariatric surgery, and so on. It doesn't provide you with a tool for understanding who the better surgeons are, let alone a very specific way to determine if surgeon A is better than surgeon B for your situation. The closest we have to anything remotely objective is something published by ProPublica a while back. They call it a surgeon scorecard. It's based on Medicare claims data. It was never submitted to peer review. It's been the subject of unbelievable criticism. But with all its limitations, it does ask a really important question, which is, how do you know for your situation if surgeon A is better than surgeon B? So to the best of our abilities to determine, there aren't any objective tools that a patient can access. So what do? there is a subjective way by which patients can understand if surgeon A is better than surgeon B. It is based on the impressions, the opinions of other surgeons. And some of this is not just a matter of gut feelings and what seems intuitively obvious, which is that surgeons know about other surgeons better than anybody else. There's actually science behind it. For example, the Michigan Bariatric Surgery Collaborative showed videotapes of surgeons to other surgeons. Those surgeons were then asked to score their peers. Now, these were blinded, so to keep the politics out of it, right? And here's what they found. Surgeon scores of other surgeons' technique correlated with objective data like reoperation rates, readmission rates, mortality, and so on. In other words, this helps to validate that a subject expert, meaning a bariatric surgeon, can actually subjectively and very quickly see if another surgeon knows what he's doing, right? No surprise. So with Surgeo, with our network generally, when we look for quality, we first get subject experts. We get surgeons who are extremely good at what they're doing, and we ask them, who would you go to for your surgery? And it's revealing because, you know, we're used to thinking about brand institutions, certain locations, certain cities. The simple fact is the surgeons don't really think in those terms at all. They think about how the other surgeon performed when they operated with him. I mean, literally, physically, we're in the OR with him. And they'll say to us things like, we can tell within 2 minutes whether or not the other surgeon is going to be any good. We can tell by the way he makes his skin incision. There is no tool that measures that sort of thing. So Sergio taps into the collective wisdom of surgeons to help it identify quality, and that is what underlies its approach, which appears to be unique as of this moment.
I love your tagline on your homepage. Access the surgeons that surgeons use when they need surgery. That's great. I have a question though about scalability. You know, there's great efficacy, and it sounds like in that screening process you use. But how do you screen enough physicians and enough, you know, procedure types that you can have enough robust content on Surgeo?
So, first of all, there are great surgeons everywhere, okay? And Kim often refers to them as the hidden gems, right? They're not necessarily in the big brand institutions. So, for example, one of the planet's most experienced urologic reconstructive surgeons for urinary incontinence, for erectile dysfunction, those sorts of things, done about 5,000 of these kinds of operations, which puts him in the top, 0.1% in terms of experience. He's in private practice in Nashville. There's one of the country's leaders in hip arthroscopy is in private practice in San Francisco. And you know what? The good guys all know each other. So once you tap into the network, you can accelerate pretty quickly. And the other thing is the model that we're using works across lines of service. So it works for orthopedics, for example, knee replacement, where we have great surgeons in some of the larger, well-recognized groups like Ortho Carolina, for example. There are a number of their surgeons part of the Surgeo network. But we also have phenomenal solo operators. For example, in Austin, Omar Akhtar is one of our people. It works in ophthalmology, where we have the guys who developed the excimer laser for use in vision correction, building out the network across the country. So it scales geographically, and it scales across lines of service. It scales from covered procedures, like knee replacement, to non-covered procedures, like penile implant. The scalability is there. The important thing is to keep the quality in place and not to compromise it just because you want to go fast or just because you want to go broad.
Arnon, how many different lines of service does the marketplace currently cover?
Well, the surgical marketplace generally?
No, yours.
No, how many different? I mean, knee and hip replacements you alluded to, and some other. I mean, is there? I mean, where are you right now in your generational growth? I mean, how many different procedures does the marketplace?
Looks like about 25 on your website, where you can select.
That's right. And That's right, and they're clustered around certain themes. So orthopedics is clearly one of them. So arthroscopy, for example, I alluded to a hip arthroscopist in San Francisco. There's not a lot of great hip arthroscopists in the country. It's a relatively new procedure, and there's only a handful of surgeons who've really done a lot. So he's spearheading that evolution for us in the hopes that we can help, obviously, preserve joints for longer. So orthopedics is one. Weight loss surgery is another. Men's health procedures, artificial sphincters for incontinence, vasectomy reversals, penile implant, those sorts of things. We will probably start to roll out other things around podiatry, GYN. We've actually had people knocking on the door who want to start building out interventional cardiology. So, for example, atrial fibrillation ablation is now standard of care along with anticoagulant therapy. That model fits beautifully into the Surgeo world. So we're going to see this expanding, and one of the things that's really fun about this is when you approach a surgeon with one idea, he comes back with something you haven't even thought of, and the market does too. In other words, our customers come to us and say, I need this, can you do it? That brings us to another point. Surgeo has, in essence, become a clearinghouse for great surgeons. It's a network of surgeons. So if we need to find a really good urologist in Phoenix or a really good orthopedist in Peoria, it's a phone call or two away for us. So it's a wonderful resource for people who are struggling to find surgical services at a high quality at a specific location and price.
Is there a, doctor, is there a cost for, I mean, you have a direct-to-consumer model. We'll talk a little bit about some of your other distribution, but if I'm a consumer and I'm interested in accessing Surgeo in the marketplace, is there a fee associated with it?
No. Surgeo.com is free. Anybody can use it. And by anybody, I mean primary doctors, HR directors, insurance companies.
So tell us about employers. If they wanted to partner with you, what does that look like?
Well, what we can offer for employers, first of all, obviously the packages that are already listed there. We can also customize services. So if, for example, you've got 10,000 employees in Georgia and you're having all kinds of issues with either the quality or the cost or the delivery of orthopedic services, you can call us and we can customize according to your specifications in the locations that you want, with the idea being that what we're going to deliver in the end is quality. What we can also do is package in all the other services, physical therapy, implant, anesthesia, those things, and wrap complications protection around that package so that you can have financial peace of mind for what we've built for you. So for an employer system, very much like a self-pay patient, these are some of the attributes that I think would be extremely appealing and very useful.
So what? Talk a little bit about, financing. I'm a consumer, and I maybe work for an employer and access your solution. What is there financing available to help consumers, pay for some of these procedures beyond the cost, beyond what's covered by their plans?
The answer to that is yes. We have financing partnerships. I'll give you an example. Last week, we had a woman who needs weight loss surgery. She needs a gastric sleeve. She went on Surgeo. She found the package that she wanted for herself. It costs around $18,000. She doesn't have it. We helped her get $15,000 as a loan to pay for that. So we have financing partnerships, and if you have credit, a Social Security number, if you live in the United States, then you're a reasonable candidate for financing.
Okay. Doctor, I think you alluded to this, but I just want to make sure our audience has clarity. This is currently a national marketplace?
Technically, it's international, and what I mean by that is we've actually put our first package in the Surgeo market in England. It's for prostate cancer surgery, led by a guy named Chris Eden, who's been doing minimally invasive prostatectomies for over 10 years. He's done over 3,000 procedures. So the technology and the model can certainly spread beyond the United States. The issue, again, is to find quality. We have surgeons who have operated abroad and know who the good surgeons are, so in many cases we will be able to spread across. But look, we have a need here at home, right? The United States needs simpler access to quality care. We think from our company's perspective, it's obviously a big market, but there's a sense of mission about this too. We want to help here first.
So, looking at some other distribution opportunities you might have learned about at our June event, are you looking at exchanges as a potential partner to have accessibility of Surgeo on these private exchanges?
Our view is that anybody who can benefit from these packages, we'd be interested in talking with, and that includes at least 4 categories of potential partners. Number one, the simplest, is the self-pay patient, like the woman who needed the gastric sleeve. She would not have had access to care without our help, financing, getting the packaging organized, and so on. Second, self-funded employers. We think we can really work with them very well, the insurance companies, and the government. Look, CMS is looking for ways to optimize the delivery of care, right? That's the entire premise behind the bundled payments for care improvement. The kinds of bundles that we're putting together conceptually fit directly into that model. So we're open to discussions with anybody who's interested with a simplified access.
Doctor, listen, it's been great having you on the program, and I want to give you a couple minutes or a minute or so to leave our audience with some takeaways. I commend you on what you're doing. I think Sergio is another example of the tremendous innovation taking place across this marketplace to really serve, the consumer. So very, very interesting what you're doing. Leave our audience with a couple takeaways you'd like to leave them with, please, and then how they can access Surgeo.
Okay, so access Surgeo is easy. It's surgeo.com, surgeo.com, like surgeon without the N, surgeo.com. Here are the essential points. If you're having surgery, you need quality. If you're looking for a quality in surgery, you need a qualified surgeon. If you want to find a qualified surgeon, ask another surgeon to help you find him. Surgeo is built around the idea that surgeons know surgeons better than anybody else. We are ripping away the mask. We are allowing you into the operating room. We are presenting you with the collective wisdom of surgeons in regards to how to find quality. Number 2, anybody can use Surgeo at any time. There's no membership fee. There's no use fee. If you need us, we're there. If you need us to develop a customized package with ancillary procedures, with complications protection, we can do that.
Doctor, it's been great having you on the program today. I appreciate it. You have a great weekend, and hopefully we'll see you out at IHC Forum West in Las Vegas in November.
That would be great. Thank you.
Take care.